Great, thank you very much. The slide has gone, Thomas, the holding slide, so we're fine. So my name's Tim Jordan. As I mentioned before, I'm the Director of the Program in Arts and Sciences. I'm going to speak for just a couple of minutes, just to set the scene for everything. We are waiting for one of our panelists, Guy Noble, who had to change accounts, and in our pandemic camera-driven age, naturally nothing is entirely easy. The program in Arts and Sciences began just under 10 years ago. Next year will be the 10-year anniversary of the undergraduate degree, Bachelor in Arts and Sciences, where UCL attempted to pioneer a really different way of doing university education, a way that brings together both sciences, arts and humanities, and social sciences in a way which doesn't require students to stream into those, but requires students to cross those streams over and to do some sciences and some arts and humanities and social sciences and vice versa. That degree's been very successful, we're very pleased to say. It's been producing remarkable dissertation work for a number of years now with remarkable kind of topics which you wouldn't have thought, where people really bring out different ways of approaching knowledge in the world. Out of that has come the program that we're here to talk about today. So this is our first launch into postgraduate education, where we launch, as I mentioned before, the world first of a Masters in Arts and Sciences, and this around creative health. And so the key here is a kind of form of interdisciplinarity, which is what we call true interdisciplinarity. It's interdisciplinarity which requires our students to deal across the hard sciences, the arts and the social sciences barriers. So although it's related to things like liberal arts, it's very much a kind of radical development in that direction. So that's just the framing of it I'm going to give. I'm going to give way in just a second to Helen Chatterjee, who's going to chair and run the session here. But there's just a couple of quick things. I did mention the Slido, but just mention again, just check in the chat for the link to that, and put up your questions and upvote the questions you think we should most look to. And the last thing I'd just like to do is to say that when I arrived at UCL last June to take up this role, and I was extremely pleased to find this program moving into postgraduate teaching, particularly pleased to see that nearly all the work to get a radical new program up and running had been done before I arrived. And I would just like to thank the team behind that, both the event today, so thanks very much Afia Afana and Thomas, Helen and Christy for the work to set up this event, but in particular for the intellectual kind of bravery to set up a program like this. And the immense work that had to go into persuading universities, which are not known to be that innovative around regulations and teaching programs, to persuade a university like UCL to go in this direction. So thank you very much to the team. And I'll now turn it over to Helen to let you start seeing about the program itself.
Thank you, Tim, and welcome to everyone. It's really lovely, even though we can't see you all, but to be joined by so many people. So, well, thanks very much for joining us today. We're really excited to be launching our new postgraduate qualification in creative health. Just to reiterate, as Tim said, that if you have questions, please start posting these in Slido. There's the link again. It's posted in the chat, and you'll also need that code. And please post any questions you get. No question is too daft. We're really interested to hear from you, and you can vote on those questions as well. So as Tim said, we're launching today a completely new qualification, a Masters in Arts and Sciences. It's the first in the world of its kind, and it really reflects the interdisciplinarity that we hope this programme will bring across the breadth, actually, of arts, humanities, sciences and medicine. And that really speaks to the theme of creative health. So we're defining creative health as creating the conditions and opportunities for arts, creativity and culture to be embedded in the health of the public. And what we mean by that is really a creative health approach, making use of the amazing assets, resources and individuals we have in communities to support those wider social determinants of health. So what I hope you'll get out of today is a greater understanding of why you might be interested in studying creative health. So the term creative health comes from the All-Party Parliamentary Group for Arts, Health and Wellbeing's Creative Health Report, which was published 4 years ago. And if you haven't read this report, please do have a look, because it contains a huge breadth and wealth of information, practice and research around this area of creative health. One of the recommendations from the 10 recommendations made in that inquiry report focused around education and training. So we're speaking directly to recommendation 8, which recommends that we need more opportunities to engage in training and learning around what we mean by creative health. And that's the purpose of our master's programme that we're launching today. Next, we really want this programme to be underpinned by the ethos of a creative health approach to understanding the wider social determinants of health. So we really draw and are inspired by the work of Michael Marmot and the team at the UCL Institute of Health Equity, which argues that a range of social factors need to be taken into account to alleviate health inequalities. And I think we can all agree that that's important now more than ever as we face the current global pandemic, where we've seen that those who face the worst inequalities in society are affected disproportionately by the pandemic. We also know that the NHS alone cannot reduce health inequalities. So in order to understand and address those wider social determinants of health, we need to look at those strong influences as highlighted by Michael Marmot and his team, that social networks and local communities strongly influence individual health and well-being. And that's where we think a creative health approach can make a real difference. So what I'm going to do for the next few minutes is just outline a little bit of information about the programme structure before I introduce our wonderful panellists. So the programme comprises 180 credits worth of modules. 4 of those modules are compulsory modules. One of those we've been teaching for the last 3 years, called Arts, Nature, Wellbeing, and it really focuses on these non-clinical approaches and interventions in health. So here we're not just talking about arts and health, but it does include the whole spectrum of arts and health, but also those wider community assets that we've been talking about that include things like nature, arts and community programmes that are run, say, through community centres, through third sector organisations, say like Age UK, or other smaller community bodies. So this is where students will really get an understanding of what we mean by creative health, both in terms of practice, policy and research. Next, we've got a module focusing on those fundamental concepts, theories, data and understandings related to, as Tim talked about, interdisciplinarity. And we really think that's important in a subject like this. Next, again, really important to this particular master's and our approach to studying creative health is the role of the lived experience. And this is represented in our module, Public Engagement with Research, which is really where we're going to be working with and alongside members of the public, patients, participants, and people with lived experience and their interface with research. And then finally, the all-important research methods. So what are those different ways, methods, approaches, and evaluation approaches that we need in order to understand the impact, the value, and the role of creative health? And here we're talking about the sorts of maybe standardized quantitative approaches that you might see more in the clinical or sciences sphere, right through to the full qualitative arts, humanities, and more arts and creative approaches to health. Because again, we really feel like an interdisciplinary approach is required when we're thinking about research and evaluation. Next, there'll be an opportunity to take 2 optional modules, and they're drawn from across the UCL spectrum. So what that means, if you've got particular areas of interest, then you can draw from existing modules that are available across UCL. And then finally, I want to say a few words just about the community-based dissertation that we've been running. So this is a practice that we started about 3 years ago on a smaller scale, working with a whole range of different community partners. And here's just some of the sorts of partners we've been working with and who've been feeding into our programme as we develop it and as we teach our module called Arts, Nature and Wellbeing. And as you can see, we've got a huge range of different types of partnerships here, from small community organisations through to large national organisations like the Trust for Conservation Volunteers. There's a big focus across both arts and creative practice, but also thinking about other community assets. So we're speaking to things like social prescribing and how we can work across the spectrum of non-clinical approaches to health, with a particular focus on inequalities. And then finally, I wanted to mention another really important partnership that we're drawing into the MASC, and that is the new National Centre for Creative Health, which you'll be hearing more about very soon. It's going to be launched in the next few weeks. And the National Centre for Creative Health is another key recommendation that stems from the APPG report, the Creative Health Inquiry. And as you can see here, the National Centre for Creative Health will advance good practice and research, inform policy and promote collaboration, helping foster the conditions for creative health to be integral to health and social care and wider systems. So here I think we've got a great opportunity for students to really get involved in that interface between research, policy and practice. And through the centre, we've got links through to a whole range of other networks. You're going to be hearing from some of those networks in a minute, but critically organisations like the new National Academy for Social Prescribing, where we're going to be having, again, special relationships with those strategic initiatives happening at a national level. So I think that's a great opportunity for students to think about those interconnections between research and education, policy and practice. So hopefully that starts to address some of your questions about why you might want to study for a Master's in Creative Health. You might also be interested in a job specifically thinking about how creative health approaches could be embedded, say, in a job in health or social care. We've talked about social prescribing. You might be interested in thinking about becoming a link worker. But also increasingly, as we're seeing arts, cultural, creative sectors, other community organisations, local governments, NGOs, voluntary and third sector organisations who are also really interested in this interface between arts, creativity, culture and health. And this is also a really growing area for research, and there's increasing recognition from research councils and research and scholarship more widely about the importance of having these wider social determinants of health and thinking about more creative ways of addressing inequalities within society. So finally, I think that's one of the main reasons to think about studying creative health, is if you're interested in genuinely addressing societal inequalities and interested in understanding the role of creativity, arts and health in addressing these wider social determinants of health. As for why you might study at UCL, well, of course, UCL is in London. At the minute, we're not able to engage in the amazing assets that we have here in London and more widely. But hopefully, once we get out of lockdown, our wonderful cultural assets, our green spaces are already available to us, but those will be opened up. And I guess that's a key benefit for being in London, is that nexus of all of those different great assets that we already have, from national museums through to this really great concentration of local community-based assets and resources, and those links into those wider sectors. UCL has, of course, got loads of great rankings to its name. It's a world-famous global university that's ranked 10th in the world, 4th in Europe, and 2nd in London. So there's loads of great reasons to think about why UCL. So if you have specific questions, please keep posting them in Slido or vote on them if you can see your questions already been asked. And if you have any other questions, please do feel free to email us at any time. I put our admissions and Thomas, who's been helping us to co-design our programme, and he's our admissions tutor. He's on hand as well to help answer those questions, and do follow us on Twitter and look at our website. So without further ado, I'm going to take great pleasure in welcoming and introducing our three panellists. We're really, really lucky today to be joined by three real big hitters in the field of creative health. Three individuals who individually have made a huge contribution to this area, but also through the organisations and the practice that they do, really helping us to understand and steer and develop and guide this field of creative health. Our first speaker is Dr. Errol Francis, and Errol is the Artistic Director and CEO of Culture and has made huge strides in helping to better understand and diversify and make our cultural practice more inclusive, particularly around arts and museums. He's also a UCL alumnus. He did his PhD here at UCL Slade School of Fine Arts, so he can also perhaps answer questions relating to being a student at UCL. Next up, we're going to hear from Victoria Hume. She's the Executive Director of the Culture, Health and Wellbeing Alliance. Again, has been working in this field for several years, but is also a musician and a composer. So comes at this from both the practice and professional policy angle, bringing them all together, and also has done really great work around research and evaluation. And finally, we'll be hearing from Guy Noble. Guy is a wonderful colleague who we've been working with for many years, both in terms of research and practice, and also made significant contributions around pulling together arts and health. So helped set up the London Arts and Health Forum and helped set up the National Alliance for Arts, Health and Wellbeing, which is now the Culture, Health and Wellbeing Alliance. And Guy is the arts curator at University College London Hospitals and runs their Arts and Heritage programme and has been a great contributor to the programme so far. So a huge thank you to our speakers for joining us today. I'm going to stop sharing my screen and I'm going to hand over now to Errol and ask you to kick off with your thoughts and reflections, Errol, around creative health and I guess something about your creative health journey.
Before we do that, Helen, sorry for interrupting. This is Thomas. Should we quickly run? We have a little poll organized just to get an idea of who the people are who are actually interested in the program, because it's also brand new. So if you don't mind, while Errol gets himself ready for this, there's 3 very quick multiple choice questions on the Slido. So if you don't mind, I'll make the poll live now. And if you don't mind quickly voting, just telling us who you are and why you're here today. Hopefully the options will be available to you to tell us just very quickly who you are. Okay, I'll make it live now. And well, I hope people can see this now. And I guess Errol can start his presentation while we leave this open for a minute or two. Thank you.
Okay. Yeah. Thank you, Helen. Shall I start? Yeah. Well, thank you very much for asking me to join this launch. It's very exciting. Just to say a bit about myself, as you said, I'm artistic director and CEO of Culture And, which is a London-based charity that works to open up the arts and heritage sector to a more diverse audience and workforce. We at Culture And also myself personally, we are very interested in the intersection of creativity and health, and I'll say a little bit about that in a moment. But I have a particular interest because of my previous career in the National Health Service and my academic interests. And I've always been interested, well, I've worked in the mental health sector, but having a particular interest in the way that the experience of mental health or mental ill health has played in our the development of our arts and culture. And I have a particular interest in the way that mental illness was such a strong driver for modernism. And Gemma Blackshaw has written wonderfully about this, and I think really demonstrates the power of the intersection of health and art. And in my work in the NHS, my first kind of foray into this area was working with psychiatric patients in photography, which is my core artistic discipline. So art at the intersection of health can reveal, I think, different methodologies to address the experience of both illness and well-being that are not really apparent and not really brought out when these disciplines operate separately. And I've explored this in my sort of curatorial practice, arts festivals around anxiety and hysteria. And a couple of years ago, we did a program with the Wellcome Collection called Cyborgs, which was interrogating how we classify ourselves as human in relation to machines and animals. And so this creative journey has taken me from health, then into the arts. And so I do really want to congratulate Helen and her team for setting up this MASc in creative health, which, as she says, is you know, a unique course in the world, and it brings together 2 great bodies of knowledge. art and science often thought to be in opposition, and we often underestimate the creativity of science and the scientific nature of art itself. And I did grapple with this issue in my PhD research at the Slade. I was trying to apply a very arcane medical concept called heterotopia, and trying to apply this to museums and how we experience museums. So I hope there will be opportunities for practice-based research in this course. And I also hope that, as has been stated, there will be opportunities to focus on diversity through this interdisciplinary practice, which, as Helen has pointed to just now in relation to the pandemic, how healthcare in different categories reflects all of the inequalities in our society. So I think inequality must be, and I hope it will be, a priority in the creative research that happens on the course, and interrogate more fully as well. And this is something we're very passionate about at Culture And, is that both disciplines, both the arts or the creative practices and healthcare, are two quite monumental areas of inequality, and they collide together. And I hope that this collision can be creative, that will open up greater inclusiveness and more insights actually into the practice around creativity and health. I've just written a paper actually for the the Behring Foundation about this very problem, that what we call arts and health, it actually is quite an elite area. And there are a lot of people from diverse communities and backgrounds doing work that they don't call arts and health at all. And I hope this will be an opportunity to draw in those practices and drawing the people who are leading those practices and make it more inclusive. And so I hope that this will also be addressed in terms of the student body. And having studied at UCL, I had a wonderful experience, but I would say that one of the issues that the university does need to deal with is the diversity of the student body, and I hope that this will be an opportunity to do that. So there are so many exciting areas of research that that we can explore in this intersection of arts and health, and I wish the team all the congratulations really in the way the way forward, and developing this really unique course. So thank you very much for the opportunity.
Brilliant, thank you, Errol. Some really fantastic points there, and I think really helping us promote our ambition that we want to make the programme as diverse and inclusive as possible, and that is both through the students who we hope will apply, but also through the partnerships. So you've heard from Errol and the sorts of brilliant work that goes on at Culture And the various initiatives and projects that he's run, but likewise, we hope to extend and expand those sorts of partnerships that you've heard a little bit about, but that really comes through the partnerships and that student body. As Errol says, it's really important that we attract a diverse student body. So if you do have questions about applications and the applications process, any of that, then do give us a shout. Thank you very much, Errol. So next, I'm going to hand over to Victoria Hume from the Culture, Health and Wellbeing Alliance. Thanks, Victoria.
Thanks, Helen. Thanks for asking me to do this. I'm sorry it's so dark here. That was kind of bad planning on my part. I'm going to talk a little bit about my own history with this work, I guess, and then a little bit about the Culture, Health and Wellbeing Alliance and the wider context. So I worked as a hospital arts manager in the NHS for about 15 years, and that was from about just before the millennium. And I ran all sorts of programs to try to improve the physical environment, but also to try to address specific health problems. So we set up a choir for people with chronic respiratory disease, for example. But at the same time, I was working as a musician, as Helen said, and eventually got involved in writing music about health. So in some ways, it was using music as a way of researching specific experiences. I'm quite interested in what it is that creative approaches can bring us in terms of knowledge creation, as well as the impacts that they have on us. So I've written a couple of quite long pieces about delirium in hospital, another one about voice hearing, another one about chronic respiratory disease, and all based on workshops and interviews with people who've been through that experience. I've also worked on arts programs in health contexts in South Africa, which is where I am now, which is why it's a bit darker maybe than it is in the UK. We are 2 hours later than you. And like a lot of people that work in this area, I've had a real sort of mix of different roles across research, practice and strategy. But the thing that really strikes me is that across, it's been quite a long time now, and across that time, I think what's changed most is how much more seriously this intersection between creativity and health is taken by funders, by people in the health service, by people in local government, but also just as a general sense of how much more normal the concepts are than they used to be. When I first started doing this work, it was considered extremely weird to see a group of musicians on a ward, and now that's a much more sort of acceptable, normal concept, I think. Singing for lung health is another good example. I had friends that thought it was hilarious that we were doing that work in 2007, and now in 2021, a lot of the big cultural institutions are sort of picking up that baton, which is great to see. But all of this is the result of a lot of really persistent grassroots community-based work around the country. And I think it's great that your program is going to stay connected to that, because that really is where the energy and the innovation is. And what's so exciting for me about this master's course, that it's taking this cross-disciplinary approach to a new level where we can really start to look at what it is that keeps these worlds apart, and also how we can bring them together, essentially to try to make people's lives better. So all this time I've been involved with networks that are trying to build practice and research into this work, both in the UK and in South Africa. And most recently, that's been the Culture, Health and Wellbeing Alliance. So we are the coming together of two preceding alliances, one of which Helen actually founded, the National Alliance for Museums, Health and Wellbeing, and the other was the National Alliance for Arts, Health and Wellbeing. And in some ways, we also emerged out of the energy that was created by the Creative Health Report that Helen's referred to. And I hope we'll be working hand in hand with the new National Centre for Creative Health. We're a big membership organisation. We've got about 5,500 members. We're free to join. We're funded by the Arts Council England, as what they call a sector support organisation for the cultural sector. And our members range right across the sort of full breadth of this world, I guess. So freelance practitioners, museum professionals, hospital arts managers, libraries, health commissioners, local government, and so on and so on. We've got regional champions around the country. We work with national organisations, and critically, we work in partnership with the Lens, which is the Lived Experience Network, and their mission is to ensure that the voice of those with lived experience remains at the heart of the arts, health and wellbeing movement. Since lockdown, we've been producing reports on what's going on around the country during COVID. Given where we are, I'll just talk very briefly about those, and perhaps just reflect a bit further on the context of inequalities that we find ourselves in, and how the MASC might relate to that. So Helen's referred to Michael Marmot's work already, that, his descriptions of a decade of accelerating health inequalities, and the pandemic's made those even clearer and in fact exacerbated them, as we all know. So at the same time, as Errol has already said, the cultural sector's inequities are being laid bare in terms of class and ethnicity in particular, and the people that are most at risk of leaving the cultural sector at the moment tend to be those of diverse backgrounds, or with less economic backup, essentially. And so in culture, health and wellbeing, we've got these twin problems, culture and health, and yet there is this potential that in bringing these two sectors together, we might contribute to addressing the inequalities in each of them. And just to give you one example, there's an organisation called Red Earth Collective in the West Mids, based around Birmingham, who specifically work with the arts to improve the mental health and well-being of marginalised and racialised communities. So it's a direct response to a history of racialised mental health treatment in this country. And it's not despite that, but because of it, that they work in partnership with the NHS, with mental health charities, with faith communities, with universities. And it's really this partnership approach that starts to break down the barriers and address some of the inequalities that they're seeking to tackle. we've been bringing case studies together in the last few months, really focusing on the people who are the most likely to be suffering the worst consequences of the pandemic. So 50 case studies of work reaching people shielding at home, 45 of work reaching people in institutions, so care homes, hospitals, but also prisons, young offender institutions. And 80% of those organisations are working in partnership. It's similar kinds of partnership to Red Earth Collective, with universities, with local authorities, with health partners. You've got arts organisations working with social workers to reach families seeking asylum, reaching people in poverty through local authorities, and so on and so on. If they tried doing this work on their own, they would have no reach, essentially. It wouldn't be effective. But again, it's this coming together across the disciplines that's really beginning to tackle limitations and structural problems, I think. So the people are trying to meet a range of needs during COVID, but essentially these projects are about supporting social connection, family connection, building people's confidence, tackling isolation, tackling loneliness. And the bulk of the organisations doing this work are tiny, which is again very typical of this sector. So it's often one freelancer, or as a general rule, organisations that employ between sort of 1 and 10 people. And that's part of what makes this work so interesting, that you have this incredible range of people doing it, and these very sort of fleet of foot organisations adapting to complex circumstances. But there's also demand. I spoke a bit earlier about the shift in perception of this work, and another big shift, I think, is that there's real demand coming from health and care institutions. So even though people in hospitals and in care homes are really struggling with their own workload, they are making time to bring in creative practice, because they really, having worked with creative organisations for some time, they really understand the value of this work. And that's a big shift, although we have yet to get to a point where this is consistent around the country. So it's a real moment, I think, where we can see and understand the value of creative activity to bring us together despite everything that's happening around us. And this Masters is incredibly timely, and I think gives us a massive opportunity to understand what's happening at the moment, but also the sort of broader, longer context, and try and break down these professional and intellectual silos to all of our benefits. So that's me. Thanks, Helen.
Brilliant. Thanks, Victoria. And I see Rita has posted a message. And Rita, I'm just going to put a link to the Culture, Health and Wellbeing Alliance's coronavirus resources, which includes all of the brilliant projects and many, many more that Victoria's mentioned. And if you're not a member of the Culture, Health and Wellbeing Alliance, it's free to join, as Victoria says, but it is really a wealth of information available there. And it speaks to many of those areas that Victoria's already mentioned around how the arts, creativity and wider, a lot of those organisations interface with green space, outdoor spaces, natural heritage. And I think that it really gives a sense of what we mean by creative health. So do have a look if you haven't already. And I shall now hand over to our final panellist before we have a little panel discussion. Really pleased to welcome Guy Noble from University College London Hospitals. Over to you, Guy.
Thanks so much, Helen, and to Tim and Thomas as well for inviting me to talk at the launch of this fantastic MASC. Generally, I am really thrilled to be here because working in arts and health for the last 25 years or so, there's not really been a very kind of clear career route into working in creativity and health. And I think this MASC will certainly provide a career route into this sector, which is certainly very much needed. Anyway, let me introduce myself and explain a little bit about my own personal journey in creativity and health. I'm the arts curator at University College London Hospitals NHS Foundation Trust, just opposite UCL on the top of Tottenham Court Road. And it's my role to improve the patient and staff experience through the use of the arts and creative activity. Being a curator, I care for our art collection in the hospital and use the arts to care for patients and staff. I do that in a number of ways, including commissioning artists to create site-specific artworks for new developments. We also have a changing exhibition programme whereby local and national artists can exhibit their works. We programme musicians to perform in public spaces throughout the hospital and by patients' bedsides. And we also work with a number of artists to deliver creative workshops to patients by their bedsides, or more recently with COVID, virtually. These creative sessions are also offered to staff, and currently we are developing a music on prescription service. And this is as a result of the COVID pandemic. A lot of our staff are increasingly burnt out and stressed. And as Victoria mentioned, there's been a real demand for occupational health services, and it presents a massive opportunity for our hospital arts programs to link in closely with our occupational health teams and staff psychological services to provide creative solutions and potentially activities to assist in the recovery of our staff going forward. So it's a really interesting time to be working within hospitals. Also run artist residencies whereby an artist might team up with a particular medical specialism or researcher and use the arts to communicate a particular illness or disease. Part of my role is also to fundraise for the programme, as well as evaluate and measure the impact that creativity has on health and well-being of staff and patients at my hospital. I started my working career must be 23 years ago, setting up and establishing Addenbrooke's Hospital's arts programme in Cambridge. At that time, arts in hospitals, although not in its infancy, was certainly in its teenage years. A little bit vague, fragmented, with no strategic vision, and perhaps a little defiant too. And as I said earlier, there certainly was no obvious career route into the sector. The landscape that I arrived in felt small, felt isolated, and there was little appreciation from the medical and the wider arts community of the impact that creativity can have on health outcomes and addressing inequality. There were, however, a number of leading organisations and individuals that I sought out and that influenced my practice at the time. For example, Chelsea and Westminster Hospital, and I think Victoria was working there at the time, Lime Arts in Manchester, Guy Eads at St Mary's in the Isle of Wight, and the late, great Mike White at the Centre for Medical Humanities in Durham, whose work spanned academia, arts practice and community development. And Mike was instrumental in developing research practices in arts and in health. The work done by these organisations and individuals made it clear to me the importance of underpinning my practice with research and in turn influencing policy. A great change for me in the sector was perhaps in 2004 with the research report of Dr. Rosalia Starokov, Arts in Health, which was a review of the medical literature. This report was something that I was able to draw upon to begin to make my case and justify the role of creativity in healthcare. This was launched in tandem with the prospectus from the Arts Council and the Department of Health, which was entitled, imaginatively, A Prospectus for Arts and Health. This marked the first coming together of the Arts Council, the Department of Health, and the academic sectors, so important for a field that is immersed in interdisciplinary work. Meanwhile, behind the scenes, organisations such as the London Arts and Health Forum, which was run by then Damien Hebron, which both Victoria and I chaired for a number of years, began to bring together researchers and practitioners to develop a vision for the sector. There began over the next 10 years, I would say, a proliferation of arts and health projects within hospitals to something like the 300 or so that are in existence in the UK today. Starokov's report in 2004 and the more recent 2017 APPG Creativity Health Report demonstrates to me the interdependency of policy, practice and research that are so vital in the underpinning of my practice at University College London Hospital. It may seem obvious thing to say, but without these three strands of work, I would not be able to justify my role, nor care for the patients and my staff and my organisation. This is really why I'm so excited about the MASC, as it will provide people with the skill, knowledge and experience to articulate creativity's ability to change lives and address inequality. Thank you.
Wonderful. Thank you very much to Guy, and thanks very much for sharing your time and your experiences to all our panelists, Errol, Victoria and Guy. Chaps, if I could ask you now just to think together as a group, and I don't know who wants to respond first, but something that we talked about when we were developing our plan for today's session, which was just something to kick start us as we just start our panel discussion around I guess what it is you wish you'd been told or known or studied or had training in before you started your careers. And it could be to do with creative health, or it could be to do with any other aspect that interfaces with that. I don't know who wants to go first, who wants to volunteer?
I'll jump in. Almost everything is my answer to that question. I think I spent the first few years making terrible mistakes, really. I mean, there are advantages to learning from experience, obviously, but I think Guy summed it up really nicely, that sort of connection between research, practice and policy is not something that I really grasped at all to begin with. And I think going into this work with that underpinning you would just save an enormous amount of time and be working much more effectively from the beginning, rather than kind of experimenting in a slightly lonely way, which I think is what we were all doing. As Guy said, it was a very disconnected, fragmented world at that point. And I think feeling confident about articulating the work is the absolute key. And I think we do still struggle with that in this sector, and not feeling sort of beholden to the great thing about an interdisciplinary masters like this is that you're not sort of beholden to one sector or the other in a way. And if you come out of it feeling confident speaking to health professionals as much as you do to a cultural professional, that's going to be a great start, I think.
Errol, I mean, you mentioned, Errol, about your initial training in mental health. I wonder if you could talk about that, and then how that interfaced with your PhD.
Yeah, it's a complicated story in a way, and a journey as well, because the way that I was working in mental health was very much around inequalities and the way that Black people are treated by the mental health system. And it was a dreadful time, actually. It was a time of grief, because we lost patients, through the collateral damage from the treatment itself. So I sort of developed a real skepticism towards what medicine was doing, and I started doing these art projects with patients, and I was really clear that I wasn't doing treatment, that the art was not meant to be treatment, and that's what caused the trouble, actually, because the day that I remember deciding to leave was when I was phoned up by somebody in the finance department who said to me, "You've been buying photographic paper for all these, and cameras for these patients. Shouldn't you be buying drugs for them?" That's what he said. And I think that's a very crude example of it, but I think that in some ways the price of the acceptance in some sectors of the health service of arts work has been the total instrumentalization of it, that it must reveal these, and I'm not against that. We've got well documented outcomes for various arts practices on people's health, but as an artist, I was really keen on giving the patients a good time. That was it. I just wanted them to have a good time. I wanted them to enjoy themselves and be able to express themselves and use art as a form of expression. And I think that tension still exists with stuff like, social prescribing and so on, is that there's this real tension between, the use of art for therapeutic reasons and whether it's just for, can we improve somebody's well-being? Because, my definition of well-being, and I think the WHO, I think it's the WHO definition, which says that well-being is not the absence of disease. It's not, you can live with a disability and still experience some well-being. So I think there's some complex issues to negotiate with the intersection of these two practices.
Yeah, thank you. I think that's a really important point, and I think, you know, we might want to come back to the evidence base, and that's something that, you know, we've been discussing for many years, and it's I think you're right, it's still an issue and a challenge, but there'll be a lot of focus on the evidence base, both critically appraising it and also thinking about what do we need to do and how to better understand the evidence base. What new practices might be needed within that evidence base, you know, more creative, like you say, opportunities for self-expression and ways for participants and patients, for example, to be at the centre of that, which in many cases they're not. Guy, is there anything you wanted to add to that from your perspective?
I suppose coming back, I suppose there's a recognition really that you can't necessarily achieve it all by yourself. And I think when I first started out, you know, there was this idea that you had to be the academic, you had to be the practitioner, you had to be all these things. And you just ended up selling yourself far too short. And I think what's really kind of brought home to me is actually what's key to this practice is really good partnerships, you know, partnerships with researchers, partnerships with clinicians, partnerships with your finance officer. You know, all these things are so important to make, you know, to kind of get the cog going. So yeah, I think that's the thing that kind of most struck home to me, really.
Brilliant. I'm really glad you ended on partnerships, because I wanted to sort of pose something to each of you about partnership working is really critical, as we've talked about, and creative health partnerships are a core thinking that underpins certainly the work of the Culture, Health and Wellbeing Alliance, the way that you all work as professionals and practitioners, the MASC and the new National Centre for Creative Health. And I just wondered if you might be able to just reflect a little bit on what kinds of partnership working you might like with the MASC. Guy, perhaps you could start, because you already have been supervising students as part of the Arts, Nature, Wellbeing module, but what kinds of ways can you envisage working with students and being involved in the programme?
Well, in a variety of ways. I mean, in the past, we've worked with medical students at UCH, and I think providing a kind of quite a broad curriculum is a really kind of useful and relevant thing to do. Obviously, it helps improve things around kind of communication and listening skills, and it teaches people a kind of empathy of care. And I think that's really, really important. Speaking to my clinical colleagues, I asked them around, you know, what is the best type of evidence you'd like to see? I'm just slightly straying from the point, but it wasn't around kind of numbers and figures. It was really around the idea of a lived experience, and the idea that as clinicians we can be better listeners, we can be more empathetic, and I think hospitals today are definitely trying to be more empathetic to patients. And also to their staff as well. So really think providing opportunities for any kind of students to work in that kind of healthcare environment helps them kind of reflect better on what illness is and what disease is, and what you know, what that health continuum is. I'm not sure if that really answered your question, Helen.
Well, I'm just thinking as well, Guy, just giving an example of one or two of the sorts of student projects that you supervised. What were the students getting up to?
So we had a project I've just forgotten the student's name, but assessing our project with the Guildhall School of Music and Drama, who took live music to our dementia wards, and they ran a kind of participatory art program with our dementia patients. And we were really interested in some of the kind of impact that these studies had on our patients, but also more widely onto the staff. And the student was in resident, I think, for about 12 weeks or something. And from that, a report was produced. And that report was really useful for me to actually going to funders to actually asking for further funding for the programme, because it was able to demonstrate a positive impact for those students. So for me as a hospital, it's certainly very useful to have kind of students take part in our programmes.
Brilliant, thanks, Guy. Errol and Victor, I don't know if you want to have you got a direct answer to that, or if you want to keep thinking about it, and we can start moving to Slido. If you've got particular projects or areas that you would like to be, that you envisage being involved in the MASC, you can think about that. But maybe since we've only got about half an hour left, maybe I can suggest that we move on to the questions. Thanks to everybody, you've posted some really fantastic questions, and I'm going to ask Thomas to start reading out some of those questions, and myself and the panel will do our best to provide answers. But of course, do continue the conversation and email us if we don't, or post other questions in Slido if we don't address your questions adequately.
Okay, yeah. So there are some questions that are super popular. We'll get to them shortly, but I hope the participants don't mind me asking. There's 3 questions I think that are not, because the popular questions are very practical about the program, which we can respond to, but there are 3 questions I think that the whole panel would have an opinion on. So maybe I put those first, and then we go to the very popular questions on the structure of the course. And the program. So the first one is, are you thinking differently about creative health now in the age of COVID and social distancing? So what has changed? And also maybe we should expand in terms of what changes do we think will stay with us? Hopefully there will be a time post-COVID, right? So how are we thinking differently about creative health?
Wow, that's a really good question. Who wants to go first? Victoria?
Yeah, I'll jump in. Yes and no is the short answer. I think in some ways it's just made the stuff that we already knew more obvious, in that, you know, we've all alluded to health inequalities and the issues there. I think what's happened is that a lot of stuff that was perhaps not transparent to all of us has become much more obvious, and that I mean the work that's happening, the fundamental principles remain the same of trying to democratize culture and creativity, and make sure that it becomes a more accessible space, and that people's well-being can be improved by working in that way. What's changed, I suppose, is the mechanisms. And what we're seeing at the moment is a lot of frustration, really, that people can't work face to face, because so much of this work does depend on the relational business of being in a room together, and, you know, the human connection of that. But organisations and freelancers particularly have really made a monumental effort to maintain relationships with people, whether it's by phone or online, and or by post, or, you know, whatever means it might be. And I think it's redoubled people's commitment to this work in many ways. And what will probably stay, I think, in some ways, is an increased confidence. I think people feel funders have been a lot more flexible during this time, and that's given organisations a bit of a boost in some ways, that to be trusted by the people that are giving them money. And, you know, they've slightly calm down their insistence on outcomes and outputs, and I'm hoping that will stay beyond the pandemic. A lot of organisations are also talking about maintaining what's been called a blended approach, so keeping some of the online work, which has allowed people to increase their reach dramatically, but also going back to as much face-to-face as possible to sort of bring back that human quality that I think we're all missing so much.
Brilliant. Thank you. Errol, thoughts on COVID, impact of COVID? You've been doing some really great projects.
Oh yeah, we're doing some projects at the moment, delivering public health material to care homes using cultural approaches. I'm not sure what the long-term impact of this is going to be. I mean, you know, in some ways, as I said, I've worked in health inequalities before, and there's nothing new about COVID. It's just on perhaps a bigger scale. Like all medical conditions, you know, are a big barometer of inequality. This one is bigger than most of them. Damage with other health conditions, you know, we all, you know, that is, and you know, haven't been addressed because of the pandemic. It's yeah, I'm still trying to make sense of it in terms of our practice. I mean, in terms of how long this is going to go on for. You know, we now, in terms of my organization, we've made a strategic decision that this pandemic is going to go on much longer than the government is talking about, because of the nature of it, the evolving nature of it, and the inequalities in who's going to get the vaccine in different parts of the world, and so on. So we will have to change all of our practices, and they may have to permanently be like that for some time to come. You know, this, I mean, what Victoria was just talking about, you know, the kind of social distancing. It may even be that, I mean, one of the interesting things about the pandemic is that it's kind of alerted us to how infectious disease works in general, you know, and will we ever be completely comfortable with being in, you know, crowded spaces with people without any protection? So it's a huge event that I think we're still trying to make sense of, really. I'm not sure if we can make any absolute predictions about it. You know, sorry, I can't be more conclusive about it.
Brilliant. No, thank you. Guy, anything that you wanted to add? I mean, I'm thinking, you know, particularly kind of hospital arts and staff wellbeing programs. I guess there's been, you know, some new funding opportunities, I guess, and I wondered, you know, through the NHS charities, and I wondered if that presented both challenges and opportunities.
It certainly presented opportunities. I would say that you know, I've got collaborations where we never used to have collaborations. So, for example, as I said earlier, with our occupational health team and staff psychological welfare services, we've spent quite a long time trying to find a route in to work with staff, and then suddenly, as a result of the pandemic, you know, the door opens. There's now, as you say, money available. So, you know, we've recently had a grant from NHS Charities Together to do a whole load of staff wellbeing work. So I think, but the challenge remains that of kind of the remoteness, and I think a lot of creative practitioners will find that incredibly difficult. But actually, within a hospital, you know, the day-to-day business goes on. There's still a role for improving the environment for people, and I think there are patients who have always been isolated, and what this has done is kind of focus the lens more so on those types of patients, to think about actually how can we develop a program that addresses that isolation when in hospital. So, as Errol said, you know, this isn't really new, but it's we just have to be more creative in terms of the way in which we think about it.
If I can just add to what Guy has said, and you know, the weird thing about this, well, it's probably not weird, that with this pandemic is that you know, there's a lot of evidence that the people who already enjoyed an unequal privileges in society have become even more privileged as a result of it, you know. So there's a sense in which, you know, like kids at school not having access to computers, and whose education is going to be interrupted most, and that has a knock on with how we can be socially connected through digital platforms and so on. So you know, and even with funding streams, you know, the small diverse organizations that I've been in touch with haven't benefited from, necessarily from the emergency funding that has been available through various, whether it's health or arts channels. So there's a sense in which all of the old inequalities are actually reinforced, even more entrenched with this. That's the depressing thing about it. And I think that in our work, and I hope on this course, that this can be addressed. And I think that technology is one of the areas that really is the marker, the platform that we're using now. Who has access to the fastest internet and can continue their work as normal before?
Yeah, thanks. So, well, I think that's a really important point. And I guess I was going to sort of highlight some research that Victoria and I and various other colleagues have been doing, which sort of speaks to specifically that the issue that you've raised, Earl. There is a big digital divide and digital inequalities. But again, I guess speaking to what Victoria mentioned about the plethora of resources and programs that are out there, we have also seen really fantastic offerings from across the arts, cultural and community sector that all have really shifted practice to focus on inequalities. And I wonder if that would have happened as quickly were it not for the pandemic. And, that has been about new practice, say, working to do, deliver postal packs or working, say, with food banks or risk registers. And so I think there will be some really great learning that we can do from the pandemic. And I agree with Errol that at the minute, I don't think there's huge sums of money flowing towards those organisations yet. But what I do think that we're starting to see, as Victoria said, is a wider recognition from health and beyond that actually arts and creative approaches are one of the key solutions to tackling inequalities in communities. And I think that is a real shift that has really only happened in the last few years. Just if we think about social prescribing, that has really spread out and increased in terms of the offering of what's available in terms of referrals, but also how link workers are being deployed with a real focus on inequalities. There's lots of questions around the training and support that those professionals need. I think they're under a huge amount of pressure to deliver a lot. But they are doing some fantastic work alongside the sorts of arts, creativity, community organisations we've already heard about. So yeah, I think there's still lots of challenges, but hopefully this has really highlighted how important this sort of work is.
Okay, I have another one for the whole panel, and I think this relates quite nicely, although it's a bit of a skeptical voice, but it'd be interesting to see what everybody has to say to this. And that it asks about what are the downsides and dangers of personalized medicine and social prescribing? Is it driving the privatization of health services and further inequalities?
Oh, really good question. Who wants to, anybody want to jump in? I mean, I think Errol's point that he's just made about there's always the danger that the people who would already accessing arts, culture, outdoors, community assets will continue to access them. And, we really have to think about how we are reaching hard to reach, vulnerable, marginalised audiences. And at the minute, that hasn't been a core part of many organisations' USP. It hasn't been a core part of funding. But we are seeing shifts that, there's the Thriving Communities Fund, which Arts Council are running on behalf of the National Academy for Social Prescribing. Again, it wasn't all about inequalities, but they have had a big focus on thinking about working, say, with isolated, vulnerable, shielding audiences. But I think there's, I agree. I think there's still a lot of work to do. I agree with Errol. I don't know if anybody wants to jump in.
I mean, really just to reiterate that, I suppose, but I think the real risk with social prescribing is the lack of investment and the danger that it will be something that is sort of palmed off on the third sector without adequate funding to support the work. And that presents a risk for the cultural organisations themselves that may not have the capacity to cope with additional demand, which we're sort of seeing at the moment, actually, that a demand has been generated by the publicity around the concept of social prescribing that cultural organisations are not in a position to meet. There are risks around training and making sure that people are sort of at a point where they feel they can support health needs, I guess. there's a huge number of risks around social prescribing. I think the principle of demedicalizing care is obviously one that I think a lot of us would adhere to. But one of the issues is that there was a good report that was released at the end of last year from National Voices that talked about the need to invest in infrastructure in the community sector. Essentially, if we're going to meet the NHS on equal terms, we have to have the kind of infrastructure in place to be able to do that. And at the moment, it's almost impossible for an individual practitioner to speak to an integrated care system, for example. So we need to create a much better balance between those systems. But yeah, and everything that Errol and Helen have already said, really.
I mean, I think I'd like to bring back the instrumentalization problem in relation to the outcomes attached to social prescribing. I mean, having agreed that, that the positive outcomes are good, I think the measurement of it, or the current metrics that are applied to it, are problematic, shall we say, in the sense of what I was referring to earlier about the, how do you measure just enjoyment, quite apart from the impact on, the clinical outcomes. I think that's an issue. But if I may go back to an earlier point about partnerships that you raised, Helen, I'm hoping that the medical schools, the medical training, that there's some partnership there. I think that the marriage of arts and science needs to take place in the medical training as well. I just wanted to quote an incident which I find quite funny, actually, which was a conversation between Russell Brand and a top GP, and they were talking about methadone, and he has got this campaign. He's had this campaign against it. Now the GP was saying, "I've done randomized controlled trials. I know it works," and he was saying, "But it doesn't work for me. I don't want it. I don't," and I think there's something about the artistic methodology which values the individual testimony, which I think in medicine is a tricky, we need to have thousands of pieces of evidence to support a particular approach. And I think what art has, or culture has the possibility of validating much more unique experiences which don't have this huge evidence base or outcome metrics, to support them.
I think that's a really important point, and that's something that we really have a big focus on in the programme. It's a lot of a focus of our research and the work, as you've heard, of Errol and many organisations, and Victoria and I discuss this a lot. We get asked a lot, what measurements tools should we be using? And this, debate that often exists around quantitative approaches or science medicine approaches versus then more arts or qualitative approaches. And I really don't think it's an either or, but Thomas and I were teaching earlier around this topic with some of our second year Basque students, and they just asked some really brilliant, very pertinent questions around how arts and creativity can really help to bring out, as Errol says, that the kind of participant voice. And if we're genuinely talking about a personalised care approach to health, whether it's through social prescribing referrals or whether it's through wider engagement in community programmes to support those wider social determinants of health, then we really need to be thinking of methods and approaches in research and evaluation that enables us to capture that participant voice and is participant-led. So I think there's still a lot of work to be done there on research, and we hope that our new student body will help us with that. There's a lot of discussions. I think Errol's point as well about other curricula. It's great that we've got new postgraduate opportunities, but we all need to look at what I would say is creative health should be embedded in all curricula. If you're studying an MBBS medical degree, but also what if you're studying history or archaeology? I think that the role of interdisciplinarity, I'd love to see creative health modules embedded in all of those programmes. Thomas, we'd better move on to other questions, haven't we? We could chat phrase, but we've only got just over 15 minutes left. So
there's one more question. I think that's quite broad and maybe can be put to the whole panel. Actually, the questioner asked this to be put to the whole panel, and then there are some more specific questions. So this one is, can you expand on your working definition of creativity? So it links quite nicely, which responds to the cross-disciplinary practices of the program. And how do you see socially engaged practice and art util fitting with creative health?
Great question. Who wants to pick that up? Evan, I wonder if you, I wondered if you might say something just about, you know, you're somebody who's gone and you've come from a mental health training background, and then you've gone and done a PhD that you say that interfaced all of those. So what does that look like in terms of what creativity means to you and yeah, socially engaged practice?
It's such a complicated question. And
I've got you to answer it.
I mean, you know, there's so many philosophical perspectives on this, and, you know, questions about whether creativity is innate to all humans. And I mean, I've got the view that human beings really monopolize the concept of creativity, and that creativity is all around us. I mean, I think that plants are amazingly, you know, that I'm amazed at how plants evolve ways of pollination specific to certain species of animals. I mean, it's just extraordinary how they come up with, you know, how do they get these ideas? So I think that there is an elitist definition of creativity, and there's probably a cultural one as well that's, you know, to do with dominant societies or countries in the world, and it, you know, I think that everybody has creative potential, and it's just that we don't all get the opportunity to express it. There's another and I think that what's exciting about about the cause is just breaking down some of the assumptions about, you know, creativity being more to do with artists and logical deduction to do with scientists, you know. And, you know, there's so many stories of scientists discovering things by accident, or you know, through looking for something else, and they find something through curiosity. So it's a complex category which has its own elitism within it, and I think a course like this has the potential to break it down or interrogate it, and allow more people to actually be attached or fight, or to see what they're doing as being creative, rather than, you know, a few elite groups of people.
Brilliant response. Guy, Victoria, creativity, socially engaged practice.
I suppose from my perspective, when I was starting out my career, I could have, one path could have been museums and galleries, and the other path ended up being hospitals. And I sometimes get asked why don't I work in galleries? And well, apart from the fact that hospitals have better visitor numbers than galleries, it's also more of a democratic space. It deals with all the big issues of kind of birth, life, and death. So for me, working in a space like that is about life. And for me, kind of creativity, it's all about making life. It's all about kind of change and exploring, and I think a hospital is a perfect setting for that.
Brilliant, thank you. Victoria, anything you want to add?
Not really. That I mean, I agree with everything everyone said, which is a bit of a lame thing to say, but I do. The only other thing I suppose that I guess as I've worked in this area, I'm not sure that I see a clear distinction anymore between work that engages with health and well-being and more general socially engaged practice. I think what's happened in the sort of arts, health and well-being space is that it's moved into a space that's more about social change, I guess, which I think is exciting, and there's a lot of potential there. And for me, I guess the history of work in hospitals has come into a meeting point with the history of the community and participatory arts in the UK, and that has led to a really interesting intersection of interests and possibilities.
Brilliant. Yeah, I totally agree. And with Errol's point as well about, I think that's what we want to really shine through in this particular program, is that kind of democratizing creativity in that way. And that is through socially engaged practice, but that happens both in terms of the student body and the sorts of partnerships that we have. And I think in the sorts of disciplinary contexts that we draw from. And so all of that needs to be fed into it. And that idea that the students who join the program, we really want to join on those terms, that everybody joins on an equal status and has as valid points to share it. And that sort of creative approach, we hope, will be embedded in the way that you engage in the program, as well as our partners. So I hope that answers your question. Thomas.
Okay.
More questions for
yeah, so we changed mode a little bit. So the questions now, these are the very popular questions in the Slido, are more about the structure and aspects around the program. And the first one is on funding. That was the most popular, unsurprisingly. So what funding, if any, is available for this course? And the question is then continuing that they have been furloughed and would struggle with the finances.
Yeah, I think it's a really important issue, I guess, for all universities at the minute. Is universities are also under pressure, and we would really like in the future to have sponsored scholarships associated with the programme. At the minute we haven't, but it is part of our future vision for the programme that we will have some sponsored places. It's a really big challenge for universities in terms of fees. We know that, and we know it's a big issue. Errol's already talked about places like UCL and how you can embed diversity inclusion when the fee structure is such and the admissions criteria are such that can be prohibitive. So I'm sorry, that's a very woolly answer, but definitely in the future, it's something that we'd like to look at. If anybody has any guidance or advice on that, as you may know, the Research Council stopped funding taught postgraduate study a long time ago, which I think was a real shame. But then we also stopped when I would never have done a degree if I hadn't have got a full student grant to do it. And that the same applies for postgraduate study. I would have never been able to do a master's had I not got a scholarship to do it. All of that funding has dried up, of course, for undergraduate and postgraduate, and similarly for postgraduate research. That funding has diminished compared to what it used to be, and at a time when demand has increased. That said, we would really like to also have offerings around postgraduate research opportunities in creative health. So that's another area we're looking at to support funding, and also around having alternatives to studying creative health, say through CPD or accredited programs that would be much cheaper and offer components of the sorts of topics we've been talking about today. So I hope that provides some optimism for the future and answers your questions.
I've also posted the UCL, the link to the pages on scholarships and funding from UCL. So there's some information there, which is hopefully useful. Okay, the next question is whether it's a distance learning course or if there's scope for it to be. And maybe we can take this together with what would the structure be for the part-time version of the course, for the part-time course? Yeah,
so in terms of distance learning, again, we'd never envisaged this in the first instance being distance learning, but that's because we started to work on developing this 2 years ago, where we could never envisage the world that we currently live in. And so we have been thinking more and more about that. It won't be available for the next academic year, so for admission in September, but it's really an area we'd like to look at. And in terms of that sort of program development, like the CPD and more accredited programs, those are definitely areas we'll look at in the future.
This one was quite popular as well. Is there opportunity for artistic practice during the masters, or is it solely academic? For example, could there be a dissertation that's in part an artistic project or piece?
Yeah, well, just to say a little bit, I mean, you've heard about some of the sorts of examples of projects they do. Guy talked about a project with the Guildhall of Music, and all of those sorts of community partnerships that I talked about, and I showed some of the sorts of community partners that Thomas and I have built up over the past 3 years. so that the research project is really decided by those community partners. So it might be Guy coming to us or Errol and saying, we've got this particular piece of evaluation or research that we want doing. It might be them saying, we need some support around, say, supporting with fundraising. We've had students writing fundraising bids. It might be more on the policy or strategy side, as Guy's said, that can be really important for individuals and organisations who are looking for support. So I think the creative practice would come both the potential within that, so within the scope of those projects, those organisations may well, and we've had this, I'm thinking about one of our festival partners that we've worked with, where the students have got involved at kind of all levels of both helping to develop and deliver programmes that's involved creative practice, so they've been able to draw on their own experiences. But also I think in, for example, how information, material, data is gathered and expressed, and Errol has talked about, you know, some of the challenges around the pressures that we're under to evidence the impact of the work that we do, and we tend to use these sort of same evaluation approaches, you know, a visual analog scale or a quantitative measure or an ethnographic study, but we're really interested in these more creative approaches where we can foreground participant experience. And I know that, you know, Errol's talked about Culture Round and how they are interested in that work, but we know that lots of the organisations that we work with would really love to have students working with them to develop that kind of more creative and arts-based approaches to research evaluation, how you could make funding bids, you know, more appealing, that have that embedded and creative practice embedded. So I think there's lots of opportunities around that. And obviously within the taught modules, there's big creative elements that we've built in.
I think this one links quite nicely to this, and this is, could you say a little bit more about the community partner organizations with whom you have worked and how research placements will be organized?
Well, I hope that has answered that question. I mean, as you've seen from that slide, and just a reminder that the slides from today and the recording of this session is going to be available on our website. So that the partners that we have are very, very varied. Some of them are very small organisations, community organisations run by one or two people, in some cases volunteers, through to then big national organisations, and they dictate the project. So the projects that, for example, Guy talked about with the Guildhall of Music and UCLH Arts Programme, those were projects that have been running within the module. So now what we're doing is working with partners to expand that out to be a much longer student project, where you'll be working with the organisation for a period of time, which will be from about sort of end of March, April, right through to the end of September. So that's quite a decent amount of time to be embedded within that organisation, working and co-designing and co-producing that piece of research. So I hope that gives enough information about what the projects look like. They really are varied. As I say, everything from research, we've had policy and strategy documents being written, haven't we, Thomas? Really addressing what those partner organisations want, and that I think is where the real benefit is, because it's about, once I've done this postgraduate qualification, where do I go next? And understanding what those sorts of creative health partners are doing is really critical to that. I've just realised, Thomas, as well, I didn't answer the question about part-time, full-time. And there is an element of flexibility here. So it will be a combination of taught and compulsory and optional modules in year one, and the same in year two. The only stipulation that we have, and then the dissertation either being started in year one and extended in a part-time way, depending on the partnership and what they require, into year two, or entirely embedded within one of those years. The only stipulation that we have is that certain compulsory modules will have to be undertaken in term one, in year one, and that's really arts, nature, well-being, and the research methods, really because you do need some of those fundamental groundings in those topics in order, I think, to proceed. But there is an element of flexibility around the rest of it. So I hope that answers that question.
Okay, great. Yeah, there's a very simple question which I can just answer. I hope I get it right. Helen or Christy, stop me if I don't. And that's just how many places are available on the course. And if I'm not mistaken, it's 25 for this year, increasing, I think, to 35 next year. And eventually I'll be going up to 50 when we move to UCL East. That's sort of the plan. So in the next 5 years that we would essentially double, ideally, but starting with 25 this year. Is that Helen is nodding, so I hope, yeah, that's correct.
Yeah.
There is one more question that I think this is a quite important one, so I pulled this up a little bit. Could you please explain the main differences between the Masters in Creative Health and Health Humanities?
Yeah, really good question. So I'm Victoria, who comes from a health humanities background, and both of us are sort of interface with those guys. Can speak perhaps a little bit about what her perspectives are on health humanities. So the main focus, if you heard of the MASC, is very much around creative health partnerships. So it's about that research policy practice interface around exactly the kind of work that you've been hearing about today. So that is in contrast, I would say, to health humanities, which has much more of a focus on the scholarly context for how arts and humanities interfaces with health and medicine. Often that's from a historical perspective, so using those humanities lenses to kind of shed light on health systems, on understandings of health and medicine. Victoria, I don't know if you want to add anything to
No,
that.
I think you've summed it up perfectly.
Phil. I'm very conscious of time, and we only have 1 minute left.
Yeah, so what I'll do is in the chat, I'll post some links for additional information, and any questions that we don't get to today, and there's quite a few, as you can imagine, we will respond to them in the FAQ section, which I'm just sending you all a link. So the FAQs will, those questions that are of relevance, that clearly some of you are interested in, will respond to those. Should we go out on the question on careers? There are a few questions here. How do you see the careers develop? And it says here, over the next 10 years. Do you think the government will support this, or will it be left to the third sector?
Wow, really good question. I'll ask our panelists to respond to that as well. I mean, I think in the near future, we can see there are new opportunities, say, for link workers, and certainly, Errol and I know the museum sector best, but there are increasing posts for the interface around creative health. Just in museums, for example, having museum wellbeing officers, outreach officers, and outreach posts, education posts specifically dedicated to wellbeing. In terms of, I think, the next 10 years, I really, really hope that what we're talking about is many, many more career opportunities in this area, not least because I think, I genuinely believe that this is a route to addressing those fundamental inequalities in society, and the sorts of posts that you've heard, the wonderful experiences that people at Errol, Victoria and Guy have, and so many professional colleagues that we work with, practitioners across the spectrum, they're doing fantastic work. At the minute, it's often curtailed by funding, as Victoria said, and the size of the communities that they can reach out to. Hence, the more of those individuals we can have out there doing that brilliant work, the more people that will be able to benefit. I don't know if Errol, Guy, Victoria want to make any final points or aspirations around.
It's a really difficult question to answer. The one thing I would say optimistically is that I'm seeing posts being created in local authorities that bring together public health and culture and creativity that weren't there a year ago. And so that's a good sign, I think. But, money is an issue and will remain one for some time, I think. So who knows? I do think this sector has a knack for bucking trends and sort of keeping going despite the vagaries of political interest. So, something will be there, but it will depend a lot on what government's in power, is the short answer.
Totally agree with that, Victoria. It depends on who the administration is. Yes, I totally agree with that.
Brilliant. Well, I'm very conscious we've run over a couple of minutes, so I hope you'll excuse us. I just want to take this opportunity to thank all of you for coming today, and a particular thanks to our wonderful panelists, Errol, Victoria and Guy. Thank you so much for sparing your time, and my wonderful colleagues Thomas and Christy and Tim and Afia for all of their help and support. So we're conscious that we haven't addressed all of your questions. We will do that either individually through Slido or through emails if you've provided them. As Thomas said, please look at the links if you have more questions to us, do post those to us either via email or look at the frequently asked questions. And finally, if you want to stay in touch with us, please complete the little evaluation that Thomas put a link to through the Slido. And also you can sign up on the Keep in Touch UCL page. And again, we'll be sending that out to you all. But do stay in touch with us, and I hope you've enjoyed this evening's event, and keep having wonderful creative health conversations. Thanks very much to everyone for coming, and bye.
Thanks everyone, bye. And yeah, there's an evaluation if you haven't seen it in the Slido. If you wouldn't mind taking another minute to just tell us what you thought of the event and what else you'd like to see us to focus on before the program starts. Thank you.